Kia ora koutou. Welcome to this webinar on the Enhanced Healthcare Home Model of Care, Strengthening Equity, Consumer Involvement and Honouring Te Tiriti o Waitangi. We'll start with the karakia this evening. Give me a moment to share my screen. Tutawa mai I runga, tutawa mai I raro, tutawa mai I waho, tutawa mai I roto, kia ta'ai, te mauri tu, te mauri ora, ki te katoa, homie, huie, tai kie.
Tai kie.
Kia ora. We'll start with introductions this evening, and I will be first cover off the ranks. Ko Tararoa te monga, ko Waitangi te awa, I tipu ake I Gateshead, ko Wayne Maxwell takutane no Wairarapa ai, ko Flynn Roa, ko Tara oku tamariki, ko Amajit Maxwell aho, tēnā koutou, tēnā koutou, tēnā tātou katoa. Thank you, everybody, and I'll hand over to our panelists this evening to introduce themselves, starting with Merle.
Tēnā koe Amajit. Inga mana, inga reo, inga karanga maha, tēnā koutou. Ko mā tātua te waka, ko tauranga, ko te awa nui o te rangi hoki, te moana. Ko maua o te maunga, ko te rere a te kahia te awa. Ko ngai tarangi te iwi, ko ngai tamawhari ua te hapu. E tipu e rea kei katikati. Ko Whaea, ko Merle Samuels aho. Tēnā koe Amajit.
Tēnā koe, kia ora. Lance.
O tēnā koutou ira rangatira mākuhu mai nei e tēnei wā. Tēnā koutou katoa. Nā mui nui for your karakia Amajit. Ko au, ko mango piko te maunga, ko awaro te awa, ko te reo mihi mea waura nā marae, ko Ngāti Kuri te iwi, ko te rarawa, ko Ngāpui, ko Ngāti Whātua aku iwi, ko Lance Norman taku ingoa. My name is Lance Norman and I'm part of this group. Kia ora.
Kia ora. Kirsty.
Tēnā koutou katoa. I'm Kirsty Lennon. I'm a GP up in the Kapiti Coast. I've been in New Zealand for 11 years now. I was living in Glasgow before I came to New Zealand, but actually I was born in Nottingham, the country of Robin Hood and the Trent, but my heart belongs to Glasgow, as the song often says. But I am happy to be here tonight. Thank you.
Thank you. Kia ora, Kirsty. And Ant.
Kia ora everyone, ko Wanganui te awa, ko Ruapehu te maunga, ko Aotea te waka, ko Parakuna te marae, ko Atiha nui a Paparangi te iwi. My name is Ant Toumoua and I'm part of this panel tonight. Tēnā koe.
Cool. Kia ora. We've just had a note to say that you're a little bit on the quiet side, so maybe speaking up for our attendees would be great. Cool. Thank you. Keep the questions coming in or comments and we'll watch those coming through. My role this evening is to facilitate this webinar. Our panelists tonight will cover why the need for change in terms of the healthcare home model of care. They'll cover the importance of the consumer and the leadership that has taken place in that space, what has changed in the model of care, and how we can provide practical resources to support the implementation. The document looks great, but it's only going to be successful if it can be well implemented and supported, and that's what this webinar is about tonight, to provide some further support for those that wish to implement it. It's certainly not a one-size-fits-all, so sit back, relax, have your cup of tea and listen in. Before I hand over to our panelists, I would like to run a quick poll to see who is in our audience tonight. So give me a second. That seems to be steady enough. We've got 10% doctors, 21% nurses, 19% practice managers, 10% other clinical roles, and 49% non-clinical roles. So it's an interesting spread, but thank you for sharing. We'll have a couple of other polls coming through a little later. And so I'll just share those results. So hopefully everyone can see those. This webinar will be recorded, so it would be really awesome if we could share with our clinical teams and provide it as a training resource. Thank you. I would like to say a special thank you and acknowledgement to the leadership for this enhanced model of care mahi. And just give me a second and I will go to the next. Just 1 second. Don't you love technology? Go. Okay, so the mugshots for our leadership for this mahi. We had some great support from this team and other wider teams, but it is important, I think, that we acknowledge that these guys were our steering group and helped us achieve what we have in terms of the enhanced model of care. I would also like to say a special thank you to Merle for her nurturing role that she's played along the way and basically inspiring us to do an even better job. So thank you, Merle, for all your support and to our steering group. And on that note, I'm going to hand you over to Merle to share her wisdom and knowledge in terms of the consumer.
Tēnā koe Majid. Kia koutou katoa hoki ngā panelists. Kia rātou katoa e whakarongo ana e titiro mai hoki. Tēnā koutou, tēnā koutou. Greetings, everyone. So, as a consumer taking part in this enhancement or developing of the model of care, it's been a journey. When I first started, I wasn't even sure what the framework was about. And now, more than 18 months later, the journey has been one where sometimes I have felt like I am in a race. I'm in a race to get these consumer voices to the line. I'm in a race to get them heard. I feel like it's been a long time where people, other consumers, service users, have felt like they are saying the same thing. So the wonderful thing about coming on board with Healthcare Homes, and it was said, it was shown, and I have definitely been involved. When we've been speaking about equity or the disparities out there, as a consumer, all I knew was there were lots of concerns and they weren't being answered. I didn't know how to get them answered, but I know, having taken the step and walked through the gates or the doorways of Healthcare Homes, I've been able to sit in between, hear, listen, and have an input about how the things that we think or feel as consumers that weren't working for us. So with an honour to our governance team, our steering committee, I now am more aware that the input and the voices of the many consumers outside of this webinar, I'm so grateful. Many of them I was able to run past, many I stopped and sat, and they shared the consumer voice, what was happening in their clinic, the service they receive. And I truly believe now, after a year and a half, I'm more understanding about how that consumer voice makes an impact to shaping the service that they've all been wanting. We have professionals now that are in place, all our clinic staff, the healthcare providers, and the healthcare teams are all looking to put the new enhanced model of care that Healthcare Homes has into practice. We want people to come in through the door, see a smiling face. It looks like me. That looks like me. They're speaking to me. I can feel that it would resonate within. It would make me go back. Too often in the past, I've been places where I didn't want to be there. Not because I just got in there and thought, no, this is not for me. It's because at one time or another, judgment was passed even before I got past the reception desk. I believe the voices of the consumer that has helped to shape and enhance this particular model has become so because I know the way that we are walking, and it will be spoken about throughout the webinar, but when you are doing things in line with Te Tiriti or Waitangi, for me as a consumer, everything feels warm here. I truly believe that the experience, aroha mai everybody, I thought I'd turn the phone off. I'm so sorry to take the time on live webinar to have to do that. Coming back to the chat, may I just say, for our consumers coming through the enhanced model of care, you will have ease of access. It's been put in there, the consumer voice has been heard. You may even see somebody that looks just like you, that will bring you in on board, that will make you feel like you belong. I truly believe also, having run a race or felt like I'd been running a race, I know now we are the captain of that team. We are the team. I'm also aware, outside of Healthcare Homes, although this new enhanced model is going to be rolled out, it's actually been in the community for about 11 years now. But the enhanced model, I truly believe that it is going to serve the New Zealand communities with an experience that will change well-being. I know that the shift that is about to come is due to our steering committee, our governance board, but it is people like us, consumers, that can make this model and the service work for us all. Now, I just want to share something else before I leave. Is there was a team of 5 million. You all know what I may be speaking about, that pulled together and they did it. They made the rest of New Zealand safe. I believe the model of care is about well-being, making each and every other whānau member feel like their being well adds to their day, to their whānau, to their whakapapa. I'm actually going to I'm actually going to come away from that and also speak about, as a consumer, I have gone to the doctor, but I never knew what else lay behind the doors. What was in there? What were the pathways that I needed to know? Because I thought as soon as I went to the doctor, The nurse might see me, then the doctor, I'd go to the receptionist, and then I'd go to the pharmacy. In this enhanced model of care, I know that our governance board, our steering committee, and all those 4 domains, oh my gosh, there is such a working, as you can see behind Armajit, I believe that that is our model, and it will be spoken about, the Kawakawa tree and our values and our principles. Everything combined is about bringing whakawhanaungatanga. That is the collaboration of our principles and our values. I know that the rest of the team will speak about it, and they will lay it down for you to be able to see more clearly. As a consumer, I feel proud for the fact that consumer voice has helped to model this model of care, has helped to shape it. I'm grateful that a model of care, I wish my mother and father and my grandparents were here to know that there is somebody that will greet them. Is it in their language? Or is it because they look just like them? I believe that the connections would have been different then, like they're going to be now. I know it's unless we all get on board the same waka. Please come through the doors of house care homes. It's an experience awaiting you. Tēnā koutou, tēnā koutou, tēnā koutou katoa.
I need to unmute. Kia ora whaia Merle, that was wonderful. Thank you, ngā mihi. Lance, can we hand over to you to talk more about the why? I'll share my screen with a couple of slides there for you. Come.
Kia ora whānau. It's always hard talking after Merle, after she's introduced the model of care like that, but I have the pleasure of talking about the model of care and then how we've entrenched sort of principles from the Treaty of Waitangi into the model of care, and we'll talk about it later on. But in our healthcare system, unfortunately, not everybody gets the same level of healthcare and the same level of health outcome. So what we've done in this model is we've brought more of a cultural lens into a clinical model to support both our clinicians and our whānau to navigate the healthcare system a little bit better. The model is represented in the diagram we've got here. That is actually a rongoa plant we've got. And it's reflected on, pictorial, it's reflected on the deeper the roots, the stronger the growth of that plant. And it's the same model we want to embed in our healthcare home model. So the more we embrace our cultural component throughout this enhanced model of care, the better our whānau and our patients will be. I won't go through all of the headings there, but there's a list of the values. I'll just touch on a few ones. The second one, manaakitanga. What that means is treat me with respect as a patient, treat me as you would one of your friends and one of your own personal whānau, and I'll reciprocate and do the same back to you. The last one on that at the bottom is tino rangatiratanga. So that means self-determination. So let me be part of the co-design process. Let me determine my pathways. Let me self-navigate through the healthcare system, as Whaea Merle has said, as a consumer. And if you let me do that and give me the tools, I'll be part of the team, the clinical team that actually helps me on my own journey. And kaitiakitanga, that's the last one we've got. That's support me in everything I do. And some days I'll come and see you as a clinician, and I'll have an issue that you can't solve in your clinical space, but please navigate me to some place that could help me, help me deal with maybe a social issue that I'm having, and you have a skill set that you can pathway me through to. So that's our diagram pictorially. Now it is quite centric from Māori, because from the health point of view, unfortunately, mental health, diabetes, cardiovascular disease, drug and alcohol addictions, there's a big issue we have for a lot of our Māori community, so it is very Māori centric, but this equally could be for Pacific people, for youth, for whānau with disabilities, whānau with mental health. The key is designing a model of care that matches your patient base. Kia ora. And then just lastly, we put this out for consultation, and I see, so my substantive role is the head of equity for ProCare Health in Auckland. I get a lot of people telling me, just in general, isn't it all about equality, and don't we all get the same? Now, this diagram at the bottom, these four charts there, inequality says that the system is geared towards one particular part of the community, and it's much easier for one part of the community to access services over another. Equality means we actually get the same level of service, and an example might be every one of us has the same ability to book an appointment time with a GP or a nurse. So that's equality. Equity actually means we get treated the same, and we get the same outcome from that booked appointment. So and then justice is, and unfortunately our system, some of the things aren't really geared appropriately for some of the populations I just named. Justice actually says fix the system so that we don't have to trick the system. But I do get a lot of feedback on, but everyone gets the same access to services, but they might, but they don't get the same outcome from those services we access. So this model of care puts a huge emphasis on focusing on equity and getting the equity component of the healthcare system right.
Kia ora, Lance. Thank you for that. What I meant to say earlier was there is a Q&A button on the bottom of your screen, so please keep questions flowing, and the panel, if you've got questions for each of them, we can direct them. So yeah, we'll allow at least 15, 20, hopefully near the end of the session, for questions. Before I hand over to Dr. Kirsty Lennon, I just want to run a quick poll again to see how many who are engaged tonight are actually using the model of care or working with others to use the model of care. So let me just launch poll 2. Oh, that was very quick polling, so I'm just going to, a couple more coming through. Just to be steady. Oh, so I'll share the results. 58% yes, they're using the model of care, and no, but they're aware of it. And what is really pleasing to see is that it's a small number that are not using it but not aware of it. So we still have a little bit of work to do in that space, but clearly the awareness is there. Thank you. And I'm going to hand over to Dr. Kirsty Lennon to share with us more about the changes in the model, the practical changes.
As both Lance and Amajit have spoken about, the changes have really been focused around equity, honouring Te Tiriti o Waitangi, the improved consumer engagement, and a focus on sustainability, especially in kind of the post-COVID world. And it's aligning with the Paiora model of holistic care. We have consulted the 52575 during this process, and of course, probably later on, the Health and Disability Symptom Report that came out. So the main changes that you're going to see within the model are certainly the move of sustainability, and as you can see on the kawakawa tree behind Amajit, sustainability has become kind of first in the model of care. And this, which was previously business efficiency, this really has been on feedback that we have to show the importance of how change is part and core to the model, and also will help generate the capacity and therefore the skills as well to kind of roll out the rest of the model as well. So that was on feedback that we got, and I think it is where it belongs now. There's the biggest kind of change from a characteristic point of view, but probably is the change in the year of care to a Ho'ora or wellness plan based on the Te Whara Tapu Wha model of Maori health. And we are beginning to roll out some resources, which Ants will talk about in a little while, which are going to be uploaded to help you implement this. And we're still working a little bit on those resources, but they will be available to all. And not just a one plan, but probably several examples, so that you can choose what's appropriate and what fits with your practice. But they will be free source on the Model of Care website. The equity focus has really changed. It is with that particular focus on Maori and other priority patients, and you will see that throughout all the characteristics. Obviously, you're going to see some language changes, which is culturally appropriate and reflects our values. We want Te Reo to become really integrated into workplaces and really be part of the care that we give, helping to kind of focus on that whakawhanaungatanga that Whaea Merle spoke about, building those strong relationships, both with patients, but also with iwi and whānau and that wider kind of relationship development. And again, resources are going to be available. Whaea Merle has done an amazing video on what whakawhanaungatanga means and what that might look like. So I encourage you to go out and have a look at that. And that kind of came out of that very strong consumer input that we did during our mahi, and certainly is core to a lot of the changes that we've made. As I said, the Simpson report came out quite late in our process, but we feel that the changes that we've made do correlate to what came out in the report, and we're aligning with that. I think that what we're doing is a step forward. There will be further changes to be made, but this is a really good start on that journey. COVID-19 has affected general practice increasingly, and obviously the use of telehealth got kind of brought out very rapidly, and so some of what we're seeing aligns with that as well. And of course the move towards community health networks, which I think is kind of the next step. And we've always said that this model of care is not the absolute. There's a level beyond this, and so we are constantly changing what we're going to do as the model encourages us to do, so that we are making change appropriate, and hopefully in the future there'll be another version. But I think that as we step forward, this is a really good start. Kia ora.
Thank you, Kirsty. As Kirsty talked about, there will be resources to support, and Ants will cover that this evening. Before that, they may have a bit of sharing around whakawhanaungatanga and creating that connection with our patients, which is the first and foremost thing that will help us. Over to you, Ants. Do you two want to unmute? Oh, there.
Kia ora whānau, sorry about that. So I think we'll just shake it up a little bit, and Whaea Merle and myself are going to do some role playing around whakawhanaungatanga and connection. So we're going to splish a screen or try Merle, are you in?
She's in.
Okay, so just about, yeah, I'll get Whaea Merle to start off. I just to head I've been a practice nurse for 15 years, on the floor and in management, and soon to become an ownership in a practice. So I get all sides of the coin of being on the floor, also in management and also as a business model, just as I didn't do that in my introduction. So we'll start off with Whaea Merle. Kia ora, Merle, how are you today?
Oh, we hoha ho.
Oh, why?
Tēnū hoha. Oh, tēnā wahine kei wahora, tēnū hoha kia ho. Kia tere. Hei mahi, ants, kia tere. Tēnū hoha ho kia ia, ki taku oranga hoki.
Is there anything that I can do to help today? Are you feeling?
Ko rero mai, ko tēnei te wā ka hoki a ka haere.
Oh, I see that you've got an appointment with your doctor today, Merle.
Ai, tika tēnā.
I booked you in for that. How's everything going with the whānau?
Oh, ēnā. Aroha mai ants. E tai atu wā. It hasn't been that good, especially this morning. Aroha mai ko au, tinu grouchy a ho. Ai,
Yeah.
things are happening this morning at home and tēnā. And the receptionist didn't help very much when I walked through the door. So aroha mai.
Oh, really? Why is that?
Oh, it was probably the way I left home and what's happening there. You're asking me about it. Yeah, brings me to the point of knowing I shouldn't have taken it out on the receptionist, I suppose, or yourself.
Ah, that's all right. We all have those days when we're just feeling really, really bad and not having a good day.
Oh,
those are just the days that we have. Is there anything I can do to help at home?
Well, if you have time, I think it would be great if you could come and talk ki ngā rangatahi. To my rangatahi. There are things happening out there, and I just believe that it's probably a medical voice they need to hear. You know, nanny going on all the time about this and that's not right. Actually, you're talking to me about it makes me realize I should have bought them.
Yeah, it's hard too, because they want to listen to their nans, but sometimes they don't. Do you think they'll come in and have a chat, or do you want me to give them a call?
Do you mind? I actually think they might come if you call them.
Yeah.
Yeah, I think they're over me.
Yeah. So why don't, when you after you have your appointment with the doctor, go home and talk to them and say that you've spoken to me and I'm going to give them a call, because we can just chat about it over the phone. We can figure out if there's anything we can do to help, and we can take it from there.
Ka pai tēnā. Great idea, he whakaaro tēnū pai. Great idea. I think I will do that. Kia ora, Anne.
No worries. It's hard with those young ones, hey? Kia ora, Merle.
So I'll let you carry on with our appointment then.
Okay, thanks. So that's just an example of what we see in our practice a lot. Patients, people running late, stress, things that are going on, and sometimes we get so consumed in a rat race that we don't actually sit back and acknowledge things that are happening in other people's whānau and life. So when we acknowledge that and we let them breathe a little bit, and we can find or offer different solutions, that's what whakawhanaungatanga is. That's what is connection, and that is what brings in the level of equity where we can offer solutions. We may not be able to do it all at once. We may not be able to do it right then and there, but it's knowing people's stress, and some people will have more stress than other whānaus, and that's okay. And some people need more help than others, and that's okay too. So as clinicians, we do need to recognize that. And I think we just need to be a bit more kind in what we deliver, listening, and just not getting so caught up in our own, I don't even know how to put it, just in our own ways of thinking, and just realize that other people have lives that are sometimes chaos, or things are going on, which we all do, because we all have chaotic lives sometimes. I don't think there's anyone that has a perfect life. And so it's just been understanding and just knowing that there are different ways that we can help, and we don't have to take it all on as clinicians, but we can certainly offer that, and just have some empathy towards people goes a long way. Moving on from that, I am going into talking about the latest kind of all the resources and things that we have going, in case you guys want to or need more help in that space. So we have got videos and webinars and probably some podcasts coming up. We also, I really encourage you to reach out to your local healthcare homes navigator. Also reach out to your PHO, but sometimes I think it's just good to really look at your own team and your own clinical space. Look at your population. What's our service? Who do we need to service? What is our majority of Māori or Pacific or high needs patients? And who do we, you know, what do we need to do? Because every practice is different, and some practices have smaller and some practices have bigger Māori Pacific high needs populations. So it's about knowing your population, knowing your centre, knowing your whānau, and it's about regrouping with your team, saying, hey, do we actually get what equity is about? Do we actually understand it? And if you don't, and if you need more help, there is also the model of care navigation, which is a great navigation tool. And I'm going to throw you back over to Amajit, who's going to talk you through it. Kia ora.
Amajit, you're on mute.
Thank you. Okay, thank you, Ant. We'll edit that bit out. The team and I have been working on developing resources for every one of the characteristics of the model of care. Jess, White, Kirsty and Kyle, as part of my team, have been working extremely hard pulling these together. And we obviously have been, in the truest sense of a collaborative, been bringing in resources from all of our networks to develop these. So we have an acknowledgement on our website to thank everyone that has participated in providing resources. I just want to give you a quick demo, so we'll keep our fingers crossed that this works, because we were taking our website one step further, where we could actually ensure that all the resources are open. So we've got a pop-up here, which is the model of care. So I'll close that, but it can be easily downloaded. We've updated our patient journey video to reflect the new model, enhanced model. But more importantly, in terms of resources dotted around various parts of our website, and this is a work in progress, our website, the update, so bear with us, but you'll find links to view our interactive model of care, which will bring up the characteristics. And just to demonstrate how it works, if we take improving equity, we'll see that it links straight in to a document that gives you an overview. It basically asks, you know, what is it, why is it important, and we've broken that down into benefits for patient, benefits for providers, and then we've linked in with provider stories to bring it to life. And then this is where it really gets into the detail for those that are on the ground and want to make real transformation. They'll have resources to refer to, and again, these have come from across our network and developed as well from the centre. So these will be continuously updated as we find more and more of the resources that will work. So that's just one of them. I'm going to stop sharing. So that, as I say, every one of those characteristics will at some point in the near future will have resources linked in. I may just share one more around the telehealth resources, because there's certainly been a lot of work in that space. Let me just go back. So hopefully you're viewing this okay. So 13.1, and this is where Jess has been super busy. So again, what is it? Why it's important, the patient stories, videos that have been provided by our clinicians in terms of explaining the resource, and then a whole heap of resources, a number which I know the Doxy Virtual GP Kit ProCare developed during COVID, and others had developed resources through that period as well. So we're able to bring them together and put them in one place. So hopefully there's something in there to help people get the model off the ground. So now I've got one more poll to run, just to make sure that we are targeting the resources in the right, or the support in the right area. So this is all about what additional support might be needed. Cool. And you can always email direct to the collaborative as well, and via your PHO to let us know. But this will hopefully just give us a gauge. Oh, I think that's settled. So we will, oh, a couple more coming through. Okay, so I'll share these results. So the majority certainly want practical general practice examples, which absolutely makes sense. Online resources, training, and then some around roadshows. So a bit of a combination. So we've certainly will have our work cut out, and we'll happily tailor the resources to the need. Cool, thank you. We'll get into questions now, and I'm just going to check the Q&A box. And first question is coming from one of our PHOs, Rebecca. For those who are unaware of the healthcare home model of care, who can they contact to commence the process? I'm happy to answer that one. Obviously, they can contact their primary health organisation would be the first port of call, but the collaborative can actually certainly direct you if that's helpful as well. Another question is from Chick. Great role play. What tips do you have on shifting the kororo to one moi aspirations? Do you want to answer that one, Ant?
What was the question? Sorry.
So great role play. What tips do you have on shifting the kororo to one of? Now it's got.
Whaea, dreaming.
Ah.
Dream.
In terms of aspirations.
In terms of where I would want to take that korero. So to me, it's about recognizing when you have someone come in and they are in maybe a stressful situation. It's more about having that connection. It's about trying to do some kind of fast, I guess, questions that you can get down to what's going on, if there is anything, or people could just be having a bad day, or if there's something going on with the whānau, and how we can actually shift to get in help to be needed. I'm lucky in my practice where we are very quick to be able to do house calls and telehealth. We've got great resources where we can call on other external agencies to come in. So for me, it's about my team and my nurses knowing instantly where they can go, who they can get help for the whānau, so that it's just a smooth process. And part of that, to remember, is our proactive care, where we're doing, proactive care modelling, and a lot of you would have your high order healthcare plans as well. So just following up, and yeah.
Oh, thank you, Ant. Another question, this one possibly for yourself, Kirsty. Communication skills are fundamental to all healthcare worker training. How does the model of care make it easier to use those skills?
I agree. I think those communication skills are out there, but I think from our consumer feedback is that they're not being used as well as they could. I think the model of care helps to integrate some of the language and cultural safety into the kind of practice, and it becomes practical. And yes, I mean, Lance gives a very good example where he says, well, he would like to be welcomed in his language, and then within the consultation, if someone was going to touch his head or neck, to kind of ask permission around that. And if you were taking blood, then potentially would a karakia be appropriate before that was done. And it's about asking the questions. No one's going to blame you for getting it wrong. It's absolutely about using your communication skills to ask and to make sure that you are being as culturally safe as you can.
Thank you, Kirsty. There's a question here, and it would be interesting to see what all of the panelists think. Any online resources for learning te reo in terms of the model of care?
So there's a heap of resources. I think we'll just put them on our website. Wānanga o Aotearoa has a significant amount of existing resources, but part of the model of care is we provide those resources to the general practice as well.
Kia ora, Lance. Keep the questions flowing through. We've still got more time. One of the healthcare leads team, as we were working through the changes with the group recently, was asking, how do we have the questions, a bit around your myth busting slide, Lance, what advice would you give around starting those difficult conversations on priority populations, prioritising Māori and other priority populations? How do they get that conversation going?
Cool. So from a Māori perspective, these 4 key principles in terms of engagement across health, well-being, or any system. The first one is whakawhanaungatanga, or building relationships or building rapport, like Whaea, Merle and Ants were doing, having a conversation before you straight away get into the clinical intervention. And that generally sits with the receptionist, because that's the first person who has that conversation. The second point is some sort of needs assessment. So I didn't come in just to have my smoking brief advice today because you sent me a text. I might have had some other health and well-being issues in my life. So generally a nurse might ask me a bunch of questions about, like Ants did, how can I help you out? The third is, if I came in for a clinical intervention, please help me with that clinical intervention. And the fourth is, if I gave you something in my needs assessment that you couldn't help me with today, please navigate me to an appropriate organisation who can help me with it. If it's budgeting services, drug and alcohol, housing and employment. So if you were to get all 4 of those components right in the medical model, you would get the whole healthcare journey much improved. And a top tip I give to everybody is, you imagine if all the PMS system, everyone's data had not just Māori, but it had Ngāpuhi, or it had where their river was, and it announced that someone was quite culturally competent. So if I came in and it was in the PMS system and phonetically my name was written correctly, and the receptionist straight away was able to say, "Kia ora, Lance, how's it going? How's the Ngāpuhi Treaty Settlement going?" Because I saw that on the news the other day, and just in brackets on the PMS system, highlights that I'm from Ngāpuhi. That starts a conversation. The model of care shows that if I get on with the receptionist, I'll listen to the nurse and the doctor. If I don't like how I was dealt to by the receptionist, I won't listen to the doctor and the nurse. It's like when you go to a restaurant. If the waiter or waitress is very, very polite, you'll enjoy the meal. If they're not, you won't enjoy the meal. It's the same process. So just those sort of top tips that we can give to the organisation rolling out the model.
Cool. Kia ora, Lance. Kirsty, what advice would you give around the changes in the model? This is our third iteration, and the use of the model in terms of its practical application. How would you advise people to manage the change in focus from one model to the next?
I think there are practices who are already making changes. Certainly within Capital and Coast, the practices who are in their 4th, 5th year have actually begun to make some of those changes. And it is about little changes, but constant changes. And that's what will make the difference in the longer term. So we're not expecting everyone to get 4 straight away. And we are here to help. That's what the resources are about as well. So it's going to be a process, as with all aspects of healthcare home. It's the change process that's important. And it is about just keeping that change going and making those small changes, whether it's being incorporating dual language signs on your doors, or renaming your rooms to, a Maori name, whatever it is, you kind of just make those changes and keep them going. I think there's education to be had. We do have a large population of doctors who come from overseas. Actually, maybe what you do is you start to have some cultural training for each of those doctors that come into the country. That would be a huge start, wouldn't it? I was very lucky. I got to do that when I came to New Zealand, and I can recommend the cultural tour of Te Papa anytime. It's excellent. But I think it's time for us to kind of step up, lead this, and embrace and lead the change, and really to kind of acknowledge the history of Aotearoa and Te Tiriti o Waitangi. And my te reo is not very good. I can roll my R's, but my vowels still need a lot of practice. So please forgive me, but I am trying. And I think that's the most important thing. And that's what Lance would say. It is about the education and the constant learning that is important. Yeah.
Kia ora, Kirsty. Via Merle, how would you what advice would you give us to engage in our consumers even more? I think that we've still got a lot of work to do in that space. We've started the journey, and with your support and others by your side, but what else would you advise us to be doing? Because we're doing a lot of resources for those that are implementing this model. And as I say, it's not a one size fits all, but engage in the consumer. What is your advice?
Is that me?
Hi, Merle, yes.
Aroha. I think really hearing them, acting in a way that, actually, if I can just change it a wee bit, I hear what you're saying. It is like when I have come to the table sharing the voices of consumer. So when I go back and feedback to our whānau or some of the people that have been in groups about what I believe to be a shift for the future, or a shift that is current in each of those clinics that I may have visited, I am not sure actually how many consumers ask their doctor what model of care are they implementing. But when you hear people say things like, I really don't like the way the receptionist looks at me and tells me, what's your name? I said, oh no, you must have heard wrong. But just in saying those few words throughout the panel tonight, we have shared the word whanaungatanga, or rather, whakawhanaungatanga. I'm just wanting to come on board because whanaungatanga has been done and it gets used a different way. So although there are 6 of us, counting Jess, on the panel, we all have 6 different views and the layers of how whakawhanaungatanga actually gets served. It is about relationships and connections. It is about seeing that the other person is okay, that they're right, so that you can move along. It is, for want of a different word, getting that rapport with somebody so that you can get to the real crux of what it is. I have been very blessed, involved with our team, but very blessed to have been heard the way I was. Because whakawhanaungatanga, the front of that sentence is to cause relationships, cause connections. When I spoke earlier, I did not go into what whakawhanaungatanga was because the whole of New Zealand has been doing it since March the 25th, 2020. Because we speak about a model of care and the kaupapa or the focus may be different to March the 25th. But I believe with compassion and kindness and care, we too can be a team like the 5 million. They were able to see their way through things as the enhanced model of care is a process in progress. As I mentioned, I am aware that it is consumer feedback that can keep shaping what it is. Kirsty mentioned about learning the deal. This is not a must for you, but it will certainly change your experience of well-being from the door as you walk in, through being greeted and smiled at. Kia ora, Lance. It is enough to make you smile and keep going towards the doctor. Please, even he Māori aho, even as I am Māori, I know that this approach for this model of care, it is a general practice approach that looks at whānau patient-centric care. And whether that means something else to somebody else, for me, with it being and walking with Te Tiriti or Waitangi, I want to embrace it totally. I wish I could run out there or get on TV like the Prime Minister. The 5 million team, everybody, if you're looking for well-being, healthcare homes and the enhanced model of care, I believe, is something that you need to be able to feel that you are ready for the cultural shift. Don't be scared. Please, take it like we did on March the 25th. Be kind, be caring, and we will do the best that we can with each other. It is about well-being. Thank you, Amaji.
Kia ora, Merle. Thank you. We'll take one more question and then we'll wrap up because we'll be a couple of minutes over. One question, when our practice staff are not open to change, including key owners, are there resources to help them make the first step? I think we've talked a little bit about that, but Kirsty, do you want to add to that in terms of key owners part of it, in terms of getting those conversations?
Yeah, I mean, from a very long time ago, someone very wise pointed me in the direction of some business models, and it made me, it was a kind of like a kind of, you know, trigger moment for me around actually where you would look to get that information for your practice. And very much that consumer input is so important. As with any business, change, constant change is really the only way that people are going to survive. And particularly as the environment is changing, which is ongoing for us at the moment and changing quite rapidly, we have to keep moving towards you know, new models, new improvements. It's difficult. You will always have people who are not so comfortable with change, but it is about finding the thing that they want. It is about listening to your patients and finding out what is important to them. It is about looking at the data and making sure that some of your changes are related to that data. And if you're not really doing those things, then you're not going to survive in the long term. So yes, you know, it's hard. It is really hard when people aren't in that headspace, but just small steps, small changes, just constantly will really make a difference.
Thank you for all your words of wisdom tonight. Hopefully everyone has got their own takeout from this session. In terms of what is next following this webinar, we do have a couple more arranged, one being focused for consumers, so using our partner organisation, Health Navigator Trust, along with Fire Merle and Gary Sutcliffe and Bridget Allen, our Healthcare Home Collaborative Consumer Champion. We will hold a webinar on the 28th of October to engage the consumer and get some real direct feedback. We've also got a presentation from Jemima Rihanna Tate, who will cover the Modiora window. And again, it's getting deeper into that connection, and we're hoping to secure that for early November. And recently, Jemima presented virtually to nurses in Rome. She was meant to go over, but COVID put a stop to that. So she recently did that, shared our presentation to us. So that was really useful to see. So I'll ask the panel just for some final words of wisdom before we do closing karakia. Fire Merle, closing words of wisdom.
Whakawhanaungatanga. I spoke about the team of 5 million. Whakawhanaungatanga is not jeopardizing who you have to become, but it is more about the change that comes to you. Whakawhanaungatanga, I think I just want to keep saying the word because it means so much. But whakawhanaungatanga is about to do the cultural shift, not just for healthcare homes, hopefully for New Zealand. It's gentle, it's kind. There is no harshness about whakawhanaungatanga. Only people provide that. If we stick to kindness and care and connections, I'm pretty sure that we're all going to make this process progress probably quicker than we thought. So, whakawhanaungatanga kia tātou katoa, kei rongi a tātou, tēnā he mea nui mō mātou healthcare homes. It is huge for us. So I wish you all well, and like Kirsty said, let's all start small. When we leave here tonight, kei a koutou, he whakawhanaungatanga. Tēnā koutou.
Kia ora, Mel. Lance, final words of wisdom?
I was just reflecting, and I was thinking of Albert Einstein had a saying, if you always do what you've always done, you always get what you always got. So you always need to change your model of care because the environment is changing. If you stay doing the same thing, you're going to always get the same results.
Mm.
And unfortunately, we can't always have the same results. We need to have better results than we're currently getting. So that's just my little words of wisdom there.
Oh, ka pai. Kirsty.
Really, as I've said before, it really is about us taking the lead in this. I think we should be leading this change, embracing this change, and really making it appropriate for Aotearoa.
Kia ora, Kirsty. And Ants.
Kia ora. I feel like Lance took the words out of my mouth. It's perfect for the whole wrap up. You know, we're on a journey and we're on a change process. We are Kiwis, we are New Zealanders, we're part of Aotearoa. We can achieve a lot of great things, you know, if we are open to change. And I think small steps, acknowledgement, putting down your own, I guess, opinions on what you think is for all or for right, and looking and maybe going back over the history of Aotearoa and re-looking at Te Tiriti or Waitangi, and reading some of those reports that have come out from, you know, the Whaea 2575 report that, you know, we haven't done much in terms of change over the last 15 years that we've been in health. And so if there is a time now to change, then let's get on board. We have done change with COVID. Things are coming. People deserve good health. Māori deserve good health. They need good health services. And I think that we can do this. And I think if you just do it in small steps, then you can achieve greatness. Kia ora.
Kia ora. Thank you. I'm just going to share my screen one last time and we'll move into karakia. But first, just to let you know, you can get more information from our website, and that is the website details there. I will ask Merle to close us.
Tēnā koutou, ngā panelists, kia koutou e whakarongo e te tino mai hoki. Ana e tētahi a te karakia whakamutunga, he inoi tātou. Kia tātou katoa, te atawhai o tō tātou ariki a ihu karaiti, me te aroha o te atua, me te whiwhinga tahitanga ki te wairua tapu, ake, amene. Tēnā koutou katoa, kia ora.
Kia ora.